Welcome. I'm joined by Directorate of Health Services, Goa Medical College, State Immunization Officer, and other officers who are looking after this operation. So let me brief you certain things, statistics.
So little down.
Take mic, this mic.
Use mic. Mic is there. Down. Not there.
You take
Single
push.
mic. Single mic.
माझ्या पुढ्यात धरतो.
Namaskar. Welcome. I'm joined by Director of Health Services, State Immunization Officer, Patient Secretary Health, and Dean Goa Medical College. Let me brief you certain statistics so that we can understand how things have improved gradually. I must tell you that on 19th January, we have a positive cases of about 36 cases with a positivity rate of 38.77. But gradually that has come down. As of today, the number of cases is just 910 when compared to January 19th. There is testing availability across length and breadth of Goa, and Taluka-wise positivity rate is coming down. Facilities as far as testing both rapid antigen test as RT-PCR, everything is in place. The staff is monitoring on daily basis at micromanagement. And I must tell you, the vaccination level also, it has the second dose, it's almost close to 100%. And the beneficiaries vaccinated between 15 years age group, 15 to 18 years age group is about 52%. And the maximum positivity rate that was reached is on 19th, as I already mentioned. Now things have improved a lot. And in this, I must also tell you that the entire health infrastructure, both infrastructure as well as manpower, is continuously monitoring at the micro level. And I must request all of you through the media that we still, though things are improving gradually, but one must emphasize on social distancing and the masking, because they happen to be the most important thing. COVID appropriate behavior happen to be the most important thing in the entire management. Now, I request DHS to say a few more statistics, give few more statistics.
Good evening. The good news, as our health secretary has said, is that cases are declining. Yesterday we had 500 cases out of 2659 people tested. We know that the testing was less yesterday, but if we take the rolling average, which is the average of that day and the previous 7 days, yesterday's value was 1251. Today's value is 1124. And if you go over the last 7 days, we know that on 19/5 the rolling average was 3258. We definitely know the cases are now declining. And with regard to our bed position, today we have 325 beds used in the whole state, and 3674 are vacant. Of these 325 beds that are full today, beds without oxygen support are 216. Beds with oxygen support are only 77. ICU beds used are 32, of which only 5 patients are on ventilation. Our genome sequencing machine has arrived. However, the high-end computer is to arrive tomorrow, and we should be operational by mid-February. Dr. Gupta should tell us today's statistics. Can we just complete?
We'll just complete first and then we'll take questions. Today on February 1st, total samples tested are 4,648. Out of these, 910 samples are positive for COVID-19 with a positivity rate of 19.58. Now today at the same time we have reported 6 COVID deaths. 5 at Government College and 1 at the private hospital in South Goa. Nothing to note about these 6 COVID deaths. Out of 6 deaths, 5 are not vaccinated, and only 1 person has got a single dose of our vaccine. These are the statistics for today, and very soon media bulletin will be out.
So how many new cases today?
910.
910.
Yes. Now, the Dean Government College will give you about status at
We have
Like call mic.
super specialty block. In super specialty block, we have 112 admissions. Of this, 15 are in ICU, and out of these 15, 4 are intubated when they are very critical, and other 8 are on NIV, and others are on NRS. So they are all critical patients, but intubated are the worst. Then in GMC, we have about 68 patients. They are basically in antenatal ward, pediatric ward, and the medicine ward. Now, these patients have more of medical comorbidities, and they have tested COVID positive. The deaths today are 5 GMC, as Dr. said. Now, in these deaths, there was one who was, is a burns case, so it is like an incident. Many of these deaths which we are seeing these days, they are incidental. This patient has some other severe illness to which that has occurred, and the COVID test in this patient is positive. So we call it as incidental death. Since the Ministry of Health says that any COVID test is positive, you have to include it in the test. But otherwise, this death would have been because of reasons like sepsis, dehydration. There was 66% burns. It is very high percentage of burns this patient has died. So we would call it as an incidental instead of giving a message that it is a COVID death. The pure COVID deaths are those where you have very florid pneumonia. Now those kind of deaths are few, where patients are reporting late. And Dr. Borkan will give you vaccination.
As far as vaccination is concerned, as Madam has said, Sir has said, we on the vaccination front are doing very good. We are more than 100% for our first dose. We are 98.99 for our second dose. That is people above 18 years of age. In case of children in the age group of 15 to 18, we are 81.25. That is the first dose, and we have already started our second dose from yesterday onwards. So on the vaccination front, we are doing good. But when I say this, as you must have understood, people who are getting admitted in Goa Medical College, and unfortunately those who are succumbing to death, are mostly in the category of non-vaccinated. Even otherwise, the other day I have presented in the second wave, most of the deaths that have occurred, 75% of them were not vaccinated at all. And many of them remaining were having only one dose. So it is proved beyond doubts now, statistically, and the experience that we have in Goa also, that those who are vaccinated, though they get infected, the death rate is very less, hospitalization is very less, complications are very less. So I would urge all the media people to give maximum publicity to the fact that people who are dying, most of them, a majority of them are those who have not been vaccinated. In case of children, I would only conclude by saying that if there are any misinformations, if there are any myths that are circulating, ignore them and get your children vaccinated as early as possible, as much as possible, because these children themselves can be carriers and can spread the infection to the vulnerable people. Our drive is going very successfully. We overall in India also, Goa is doing wonderfully well. We are in the first threes in all the categories. So it shouldn't be a concern in terms of immunization, but only a few people who have not taken the dose as yet. I appeal to everybody that they should come forward and take their dose as early as possible. Thank you.
Ma'am, can we say that state has seen or crossed with the peak of the pandemic?
Yes, we can say that.
We can say that.
सिक्वेन्सिंग मशीन फंक्शनल झाले ते काय
आणि 15 दिवस
Ah?
आणि 15
Machine
Machine has
Island,
arrived.
Mission has arrived.
GMC,
No, zero.
Zillow.
सो आणि 15 दिवसांनी फंक्शनल जाते
Yes. The training of the staff is going to take place and should be done by mid-Feb.
The overall situation has improved. What has happened in January 19th, and there is a high peak. From then onwards, the overall situation has improved. And in terms of vaccination, in terms of utilization of bed, in terms of vaccine, in terms of seriousness, everything has improved. The positivity rate has come down considerably. The number of patients who are admitted in the hospitals, that is coming down. And the number of bed occupancy in the GMC and other hospitals, again, it's coming down. And what is most important is vaccination of elderly population. Because the statistics of the GMC as well as DHS indicate that the population, the persons with comorbidities and persons without vaccination, they are more vulnerable. So the emphasis is that people should take the referred people who are not vaccinated. We must urge them and request them to kindly vaccinate yourself as early as possible. And one more important point is that all our medical infrastructure staff, both from at the micro level, they are monitoring it, and everybody is closely watching, and so that this pandemic and everything is under control.
It was said that third wave would affect children more, but will we see that happening?
We do see this time children being affected, but there have been no fatalities, which is a good thing.
Booster dose, how many have taken? Booster dose.
17%?
The booster dose we have given to all the healthcare workers, frontline workers, and children. Elderly people 60 plus with comorbidities. What we have found is that healthcare workers, most of them, they have taken the dose. Those who are not infected, because having a high positivity, they could not be given the dose because 90 days have to be completed for them to take the dose. But overall, it is 19.74. So you can say 20%.
Doctor, what happens to the people who are going for election duty? They also have been forced by CEO. So are these 90 days gap will be
Frontline workers who are for the polling duties, they are given the dose in a different way. In the sense, what we say is that for a booster dose, you have to complete 9 months from the second dose. But in case of people who are going for election duty, they will be given the dose 90 days after the first dose, that is 3 months. Normally it is 9 months, here it is 90 days, that is approximately 3 months. And mostly from police and everybody, collectors have asked us timetables, and by 5th we are trying our level best to complete the vaccination of all this polling staff.
no, but this effect won't be there for them.
Was that?
For 3 months and 90, this 9 months. What is the difference? Why did this mean?
कितले इफेक्टिव्ह ठरतले ते कित्याक 9 महिने आणि
9
3
महिने आणि
महिने
3 महिन्याचे तुम्ही सांगले ना आता.
हाँ.
ते कित्याक ते 9 महिने कित्याक आणि 3 महिने कित्याक?
9 months is ideal. 9 months is ideal. But in a given situation like elections, they have also found that giving it by 90 days is equally or as good as that. So we can give that.
डॉक्टर कितलो असो स्टाफ उरला इलेक्शन ड्युटीचो आणि अजून एकूच डोस बीन घेऊन तशें कितें आसा
एकूय डोस घेवन अशें इलेक्शन ड्युटीक ते घालचेच ना. Right? Now it is only question of they having the booster dose. And we are trying our level best. Whoever is coming for the portal has been devised that anybody who was not a frontline worker earlier but is put for election duty, now he can be converted into a frontline worker and given the dose by 90 days.
What is the mandatory to take that for election duty? Third dose. Is it mandatory? Booster dose.
We
Compulsory.
have not received any circular that it is mandatory, but we have been told
booster dose, actually there is a circular given by the Election Commission. And those who are
Masha won the wrong Ramadan.
those booster dose for frontline workers and health workers is being administered as per the protocol given by the government of India. So we are doing it. And we are, and as you all know, that Goa as it is in the second dose itself is almost close to 100%. And who are becoming eligible and they are being administered.
So how do you make this non-vaccinated people across Goa? Because you are not taking statistics only from the electoral roll or some CDS rolls or something like that. And there are people who can be more than 10,000 people can be there who are non-vaccinated across Goa. How are you mapping them?
So you are talking about frontline workers?
Normal people who have not taken any doses and they are dying now.
See, we do know that, as you said, about 1% have not received the second dose. So about 10,000, as you say, are people not vaccinated.
Without
Any
without
dose.
any dose.
Yes. So these are the people exactly who the virus is now catching and they are getting admitted and some of them are dying. So these exactly are those people. These people are people, we have done our best to try to address, find out who are these people. We have gone to their homes, we are giving drive-in people who are older and who are coming, as you see the profile, demographic profile, most of them are older people. So we've done our best. There are few who don't want to take the vaccine. And these are the people we are trying to convert and make them take the vaccine because we can see that these are the ones who are getting admitted and dying.
And this is the area where we need your help and support in giving a message that the elderly population and those who remain still unvaccinated, you please kindly come and take the vaccination.
Does the government have some policy for this thing? Like how to map these people or something?
Yes.
The basic policy of Government of India is this vaccination is voluntary and it cannot be made compulsory. Wherever we have tried that it should be made compulsory by some way or the other, people have gone to the courts and we cannot make it compulsory. Our idea is to make maximum IEC, that is information, education, communication, by which we will have some behavioral change in the minds of people. The whole objective of having today's VC also is that people are aware that those who are dying, most of them are not vaccinated. And as Madam has said, we go to them and tell them you take the vaccine, but if they say no, I don't want to take the vaccine, there is no rule made as such to make it compulsory.
तर कितले असे लोक आसा तुमच्याकडे कितें अजून तेंच्यानी एकूय डोस घेवना अशे लोक गोंयांत?
When we say it is 98.99, around 1% is remaining. If it is 1%, it approximately is 10,000 people.
बरोबर आता 171 171 लोक गेले आणि कितले जाणे वॅक्सीन घेऊन असले टोटल 171 people have died in January or 170. How many have not taken vaccine?
That time the vaccine had just started. We started
No,
last Jan.
this
wave, yes.
This third wave.
Yeah, so that statistic I think GMC has, you also have it.
Yeah,
So it
I
was
have it,
coming
but-
to about 58%.
Yeah, 52%.
52%.
Till today.
But that is because many of
only in
them,
the month of Jan.
see, we can definitely say 52% have not received. But among the others also a group where their vaccination status is not known. So if they are brought there, some people are brought on from the street, some chronic cases, their vaccination status is not known. So while we can say 52% have taken no dose, we can't say that the remaining are not sure about the remaining.
As Dean has rightly pointed out, that yesterday out of 6, today out of 6, 5 have not vaccinated. And one is an incidental because of the burn injuries. On 30th, out of 8, 5 are not vaccinated. On 29th, 7 have not vaccinated out of 9. Similarly, on 28th, 15 people have not vaccinated out of 17. So the number of deaths that are happening in the non-vaccinated category. So thank you very much. And finally, I request all the media to kindly ensure